Hi, it's Dr. Odell again at Genesis Cosmetic Laser Center, where we do signature liposculpting. We remove the fat that exercise and diet won't take off, and we can reshape your body. We use multiple devices in conjunction with one another to get your hourglass figure back, your flatter tummy, tighter chin, tighter arms, whatever. But I'm going to go over on several videos kind of what this is and how we do it. We do not use general anesthesia. We do not use IV sedation. But what we do is that we will give you an oral cocktail of hydrocodone, Xanax, and antibiotic and something to control your blood pressure also. We give that about an hour or so before the procedure. And so by the time we get ready to start, you're usually pretty drunk. Okay, but the real workhorse is our tumescent anesthesia. And what is tumescence? Tumescence is what we put under the skin of the area that we're going to do. And we do not have a knife on the table. We don't do any cutting. We numb little places on the skin and make little puncture marks. Through that, we put an instrument, a blunt-tipped instrument, that goes under the skin, and we fill that area with a numbing solution. So what is a tumescent anesthesia? Several of y'all watching probably been in the hospital. So you've had IV fluids. So this is a typical bag of IV fluids like you would get at the emergency room or in the hospital for a procedure or whatever you're having done. But in this IV bag, what we do is that we'll put about 750 milligrams of xylocaine, or also known as lidocaine. Lidocaine is right here. This is what you would have injected if you're getting a mole taken off your arm, or if you had a cut and in the ER and you're getting the cut sewn up, they'll put lidocaine in there to numb it. We put about 750 milligrams into that IV bag we just showed you. And in order to keep it from stinging, what we're going to do is to give you some bicarb. So we'll put some bicarbonate, and this is sterile bicarbonate solution that we will put in with the bag, and it neutralizes the pH so it doesn't sting. And also what we add to that is some adrenaline, or epinephrine. So this is a bottle of adrenaline. We'll put 1 cc of this, and what that does, it makes the blood vessels spasm down. So while we're putting the tumescent fluid under the skin into the fat to numb everything, we're also making the blood vessels shrink so you don't bleed much. And so your blood loss is essentially, in most cases we do, if we were to check blood loss, it may be equivalent of 1 or at most 2 blood tubes like you'd have blood drawn at the doctor's office. So that's about all the blood loss that we're going to get because we use this epinephrine. Anyway, all of this is mixed in to the IV bag that we have. We hang it up, and then we have a certain pump rate that we do under the skin, and most people don't feel it. It does several things. Mostly for you, it numbs you. Secondly, for me, there's going to be a wetting of the area and spreading out of the fat so we can get to the fat easier, and then we can suction it a lot easier also. But that's our tumescent anesthesia. Stay tuned for some more informative sessions on our signature liposculpting.